Hey guys, welcome back to another episode of Nursing Uncharted. Today we are going to deep dive into what a clinical nurse specialist is. So today I have a very special guest, Dr. Jennifer Manning. So I'm going to let her introduce herself and tell us a little bit about what she does.
Wonderful. Thank you so much, Anne. Glad to be here. My name is Jennifer Manning. I'm the president of the National Association Clinical Nurse Specialists. And what I do is I serve as the president of the organization, which means that I oversee the members as well as help the organization be a voice for clinical nurse specialists nationwide. In my working life, I serve in a couple of different roles. I'm the associate dean for undergraduate nursing programs at Louisiana State University Health Sciences Center School of Nursing. I'm also the coordinator for the Adult Gero Clinical Nurse Specialist program. In practice, I'm the clinical researcher at a local magnet hospital just outside of New Orleans. It's LCMC Health, East Jefferson General Hospital.
Well, I'm so glad you took that over because I probably would have messed something up. So, congratulations on all of that. You've worked very, very hard. So, I think you're going to bring a wonderful outlook and advice to anyone that's interested in CNS, or just curious, or maybe even the first time hearing that term. So, I'm excited to deep dive with you. All right, so let's dive in. Let's define what a clinical nurse specialist is. I'm sure some listeners out there, this may be the first time that they're hearing that. So what is that role and what does that look like in the clinical setting?
Absolutely. And I'm happy to answer that question. So a clinical nurse specialist, one of the most important things someone should know is we are one of the 4 recognized advanced practice registered nurses in the country. So the other 3 are certified nurse anesthetists, certified nurse midwives, and nurse practitioners. Clinical nurse specialist is the 4th. And so that's really important information because that separates us a little differently in terms of advanced practice from other advanced practice nursing roles, like a nurse leader. In the world of APRNs, we are regulated statewide. And so it really depends on what state you're in that determines how you're defined and what your scope is. In Louisiana, where I am, we have partial practice authority, not full and not none. But what does that mean? That means that we have to work collaboratively with physicians, but we can prescribe, we can diagnose, and we can treat, and we can bill for patient care. And so that's a really important piece to start with. The other is to start to differentiate us from the other APRNs. Why are there 4? Well, there are 4 because we all have very distinctive goals and objectives. Obviously, the nurse anesthetists, nurse practitioners, and the nurse midwives have their own little niche. Clinical nurse specialists overlap the closest with the nurse practitioners because one of the things that we do is direct patient care. But that's also where we start to differentiate. In our training, we are trained in 3 spheres of work. The first is direct care. That's where you see patients one-on-one in clinics in the hospital, and you prescribe, you diagnose, and you treat, and you bill. But we also are trained in 2 other areas. One is called the system sphere. In the system sphere, we work at the system level to bring change to healthcare. I do that a lot in my role. And so what that means is, as an example, say there's something new that needs to change in a hospital. They need to bring new technology or a new procedure or a new type of practice, like transplants to the hospital. That's something that's happening at my hospital now. A clinical nurse specialist would be involved from the start to the end of that project. And when I say start, we would begin to look at where would that happen? How much would it cost? What company should it go through? What is the budget? We work with the CEO to get approval for those budgets. And then we begin to make it happen. So we sort of start to create all of the pieces and the parts of that change. And then as the change begins to happen, we work with the nurses and we work with, at the end, the patients to make sure at the end the goal was achieved. We're meeting the needs of the healthcare population. We're monitoring that we're not overspending, and we're making sure that healthcare outcomes are going up for our patients. The third area is with the nurses, and I started to touch on that in the system level. but you find a lot of clinical nurse specialists in quality departments, in academic institutions, with a lot of oversight of a lot of nurses. We work closely with them because so much is changing all the time and they're so directly involved in those changes. We need to make sure, and we're often charged with making sure that they have all the information they need, whether it be education about something new or a new drug, a new technique, a new technology, a new piece of equipment. And we make sure that they have all those answers, whether it be for reps to come into hospital and train them, or being with that nurse one-on-one, showing them and answering their questions, maybe working with new nurses coming into a new facility who have to get oriented. And so that really kind of sums up the three areas for the clinical nurse specialist. Many of us work across the three spheres, and that's what makes us, to me, the most versatile of the APRN groups. As an example, I work in the nurse sphere. I mentor nurses. I educate nurses. I work at the system level as an educator and researcher, and then also in the direct care, seeing patients. And many of us do all three in a given week. So it's a very exciting job with lots of different days.
Yeah, you talking. I had no idea. I mean, we briefly chatted about this, prior to recording the episode, but I didn't understand the depth of what a CNS does. So, just to kind of clarify maybe a little bit, you said you work as an educator as well, but that's not your only job. So I'm just thinking back in my experience, the educators that I work with in my departments, I am so just focused on, okay, they're my educator, but do they also have these roles? Like, that's going to make me look into that a little bit more too, so I can fully understand it. But knowing that we're one of 4 advanced practice, listen to me, I'm already planning my future, but that's pretty exciting. I didn't realize the importance of that position. So I think that's wonderful for everyone to understand that.
It's an amazing, amazing job. And one of the things that I wish is more people understood it, because whenever I tell a new RN, or even an RN who is looking to go back to graduate school and they're not sure what they want to do, when I start to tell them about what we do as clinical nurse specialists, their eyes just open and they're like, oh, I want to do that. And I just think that not enough people realize how versatile our role is. But also, some of us will specialize and really focus in on just one area. It just totally depends.
Yeah, I love that. And it gets me excited for my future too. I feel like my generation, I'm at the age where I need to start figuring out what my future in nursing looks like. So this is an important episode, and I'm so grateful to have met you. So what do you see the future of this role being?
The future, wow. So reflecting back, I've been a clinical nurse specialist for 15 years and was moving along just like everybody else up until COVID hit. And I know COVID impacted everyone in a different way, and I'm no different. My home life, it was affected. But in my professional life, as far as it relates to the clinical nurse specialist, that's where I began to see the future. Because where we were able to shine was that versatility in our role. The way that we bridged and the needs that the organizations had, the nurses had, that and the patients, we stepped right in with total comfort, because that's what we do. And while a lot of other professions were shifting and pivoting and trying to adjust, a lot of the clinical nurse specialists that I work with, they felt total comfort in just coming in that, this is what we do. We're going to figure it out. We solve the problem. There's massive change that needs to happen in the hospital. We don't have all the answers, and that's okay. But we're going to bridge, and we're going to go one step at a time, and we're going to figure this out. And so to me, that's where the future is, because I think we can all agree we're not going back to whatever the world was before the pandemic. There's a new normal now. And we all know it. And so that also gives us a little bit, as people, just uncertainty, and that makes us uneasy. But I do think that's where the CNS and the future of the CNS can shine. If we really, as CNSs, can show, we really need to show our impact on how we truly make a difference in those nurses that we're working with, or at the system level. How many dollars did we save? How many patient complications did we prevent? That is really where the future begins to emerge, because that is what we're doing, but we're oftentimes so busy doing it, we don't stop and say, let me write it down. on and make sure everybody's aware. We don't do enough of that, not nearly enough. But to me, there's going to be tremendous opportunity with the advent of AI and all of the changes that is impacting healthcare and helping us diagnose earlier and helping us to be more efficient in the various work that nurses do. This is a place where CNSs can step in. We first need to fully understand it like everybody else, but then we also can start bridging to the nurses, how it can help them, bridging to the companies that the hospitals interface with. How can we improve patient outcomes in the hospitals? This to me is the future. And so the future is more of what we did during the pandemic, but also capturing it so that we tell everybody else along the way.
Let's say I'm ready to take that step into becoming a clinical nurse specialist. What do I need to do? How much bedside nursing do I need? How do I transition? What are the steps that I need to take?
Okay. And I'll kind of use my personal experience. I didn't have any nurses in my family, and so certainly no clinical nurse specialist. And so I had to kind of figure it all out on my own, which is fine. Many people are going to be in that position, but I'm proud to say there's lots of nurses now in my family who've come behind me. So I think the passion speaks for itself. But what I did initially was I was a critical care nurse, registered nurse, working nights. I worked through Hurricane Katrina. It was shortly after that I started to say to myself, I really wanted to do something a little differently. Life events like that really give us some pause to think, where are we going in our lives? And is it time to make a change? And I had known for a long time that I wanted to take on a larger role in nursing. And so I started to explore the different APRN roles. Often, critical care nurses will go into nurse anesthesia because we work so closely with the operating room. So that was the first place I started. And I went and shadowed a CRNA and realized that wasn't quite for me. I absolutely love what they do, respect what they do, but I knew I didn't want to be just in an OR. I wanted something a little broader, a little bigger in terms of reach. That was the word I used a lot. I wanted to reach more people and make a difference in a larger way. And that was what led me to the CNS, because when I saw that they could work in that system level, as well as the research, because I had some research background, I knew it was perfect for me. So when I applied for that program, and that's what someone would need to do, you first need to make sure this aligns with your passion. And that can come from, in the world of YouTube, you could YouTube just about anything, but also if you can find a CNS, feel free. Ask them, hey, let's get some coffee. If you can just share with me a little bit about what you do. If you don't have one in your hospital or you're not familiar with how to find one, go to the National Association for Clinical Nurse Specialists website, and you have lots of contacts there. You can reach out. We have on the webpage, we have the colleges of nursing that have CNS programs across the country. Those directors, all of them are CNSs. Talk to them a little bit. Ask to meet with them. They would love to talk to you about the role just as I love talking about it. So then, once you decide you want to become a CNS, you need to identify what school you want to go to. We have online programs available, we have hybrid, and we have in-person. Everyone learns differently, so you need to do some self-reflection about what's going to work for you. If online is what you want, find an online program. If in-person or hybrid is right for you, find that program. Then go to the NACNS, the National Association for Clinical Nurse Specialists website, and find that program director. It's pretty easy to do. You just scroll down to the state you want to go to and find the school you want. I would recommend you look on the website at the admission requirements. A lot of graduate programs are no longer requiring the GRE, but some may still, so you may have to take it. You need to have a BSN, a Bachelor's of Science in Nursing. So if there's an associate degree nurse listening, you will need to do a bridge program to get to the bachelor's degree and have that in hand. And then find out what other requirements. As far as experience, it varies. Some CNS programs may require 1 year of experience. Some may require none. I would highly recommend, if you are just getting ready to graduate and you are thinking about this, take that NCLEX, get past that, because at my school, we admit without having any. But I've watched some students go right into graduate school and studying for the NCLEX, starting job as a nurse, and then applying for graduate school is a lot to take on, and you really need to pass that NCLEX. So focus on that first, get in your job environment, and then make the connection with the CNS director. the two of you can work together to figure out the right time. In fact, I'm doing that right now with several applicants who have identified different points in 2025 that they want to start. And it really just aligns with what's going on in their life and what will ensure their success. And so then from there, go through whatever requirements are for that school and get admitted and then begin your program.
How long are the programs usually?
Good question. So there are master's degree programs and there are doctorate programs, DNP, Doctorate of Nursing Practice. Both of them will get you to the CNS role. We, as a national organization, have not made the stance that you must have a DNP. The board and members of the organization have had lots of discussions about that. We're really just waiting for that evidence to show the big distinction. I can tell people the distinctions. I think there's huge advantages over the DNP, but we really just want a little bit more scientific rigor behind the statement. But you do need to decide. Usually those master's degree programs are 1 to 2 years, and the DNP are 3 years, 2 to 3. It really varies. So that's pretty close in time. So nonetheless, it's probably not a surprise that I did the doctorate because I feel like if I was going to invest my time, I really wanted to just get it done. And so I would encourage anyone out there considering is just weigh your options, look at your life situation. There are major distinctions between the two degrees, but ultimately you will be a CNS at the end. You can sit for the certifying exam with a master's or a doctorate.
I'm sure this varies between state to state, but is there a difference in what the role looks like with a master's versus a doctorate degree?
Honestly, not a whole lot. And I think that with some scientific evidence to show what they can do at that advanced level, that would help differentiate those two roles, but we're just not quite there yet. I think we're working on it, but no, I work alongside master's prepared CNSs and doctoral prepared CNSs, some with a DNP and then some with a PhD. Now, I do see some distinctions between the PhD and the DNP. The PhD is taught to be a scholar and have the ability to do original research, scientific research. And so they often have a little bit different, but comparing the Masters of Science in Nursing to the Doctorate of Nursing Practice, I'm not seeing a whole lot of difference at this time.
Okay. It's good to know. And just the timing, like you touched on with a master's versus a doctorate. Yeah. I think I'd want a doctor in front of my in front of my name. And my dad always joked with me when I became a nurse. Wouldn't that be so cool to be like a doctor of nursing? Like what a
totally. It
contradicts
is
itself, but it's kind of like cool to have that. So
Love it.
I can understand your push for getting your doctorate.
And I'll just add a little plug in because it takes a long time for a lot of the schooling. And some of the listeners might be thinking, oh my God, I worked so hard for my RN. And now there's discussion of more. I weighed that myself. I'm not, where someone was just throwing a bunch of money at me and I didn't have to work. I had to do all the things the rest of us are doing, raise my family, pay my bills. It was the best decision I ever made, the best investment in myself I've ever made. And from an age standpoint, it is never too late. And I can't overemphasize that. No matter what age you are, if this is your passion and this is something in your life that you want to do, the right time is now. And it doesn't matter how old you are.
That's such good advice. I love that. You can really hear and feel the passion that you have for this role. Do you know, maybe I'm throwing you off here, but what is like the percentage of nurses that go into this role? Like, are we seeing an increase? Are we seeing a decrease? Like, do you have a feel of what this position is looking like?
Sure, I actually do. Okay. I would say we're pretty stable. When I came into this particular profession of CNS in 2007, we were on the increase, but so was the NP. And so the NP at that time, there were actually more CNSs in 2007 than there were NPs. Now it is drastically different. We have about 90,000 CNSs and about 500,000 NPs nationwide. So CNSs have been pretty stable. It really depends on what region of the country you are in to kind of monitor growth or declines. There are some areas where we see some programs closing, and then there are some areas where we're seeing programs opening. I really think it goes back to where we started our conversation and the leaders of those hospitals understanding the role and making sure to carve out money in the budgets for these positions. When I encounter those chief nursing officers and those CEOs, they're asking me, how can I get more of these CNSs? Where are they? What schools are training them? And they're also asking me, why don't all the other CNOs know this? And I'm telling them, well, you need to help me tell them. But that's really the reality. So there may be some listeners who might be saying, well, I just don't see them around me. They're probably in your hospital. There just might only be one, depending on the size of your hospital. But then again, if you're in a large hospital system, there might be 50 CNSs, but you just might not encounter them because we're just not that good of screaming, from the walls what we're doing. Hey, I'm a CNS. We're often hidden under different titles and names. We might be hidden under an associate dean like me, or a nurse educator, a clinical educator, a clinical researcher like me. Some of the CNSs I work with, CNS is very clearly in their title, but some are not. And that sort of hides the profession. That's a problem as a president I haven't been able to solve. But I think in the world of the NP, they're always labeled the NP. They're doing direct patient care and they're billing and they're seeing patients. And that helps them stand out more clearly
Right.
in the profession. It doesn't diminish our role. It just means that we need to work harder of making sure people know who we are and what our educational background is.
Yes. And my brain is spinning because I'm trying to figure out, like, I actually go to work later today. So I'm going to hopefully talk to my educator and be like, what, like, is this what you do? Like, I had no idea. So I think that this has been very educational for me. And I hope that a lot of the listeners take this and now understand it, because that role is much bigger than what I ever knew. And it's unfortunate that you're not screaming from the rooftop what you're doing. But it's a very, very valid statement. You know who your NP is, you know who your midwife is, and you know who your nurse anesthetist is, but you don't know about this one. So we need to change that. So maybe there's someone listening that has some advice.
Yeah. Well, podcasts like this are helpful.
Yeah.
When y'all share them, the national organization helps me share them. And then we also have, lots of different committees and organizations at NACNS, and it's almost like a grassroots effort. We just work very hard to get the word out as much as we can. And then when we have an opportunity to present in media settings like this, but even on the news, I had lots of opportunities during COVID to talk about issues that were being faced. I made sure that I always said, I'm a clinical nurse specialist. And that's really the big initiative. We just need to encourage other CNSs out there to take that claim and be really clear about who you are, and then share all the great things that you're doing.
Yes. Yes. Well, let's talk a little, you've mentioned it a little bit, but let's talk more about the National Association of Clinical Nurse Specialists and what that is and how that's helpful and how do we access that?
Yep. So the National Association of Clinical Nurse Specialists is the only organization nationwide that represents all clinical nurse specialists. And I serve currently proudly as the president. And you can easily find NACNS by Googling it, and it will come right on up. And so when you get to the website, there's lots of great information available to non-members that you can access. For example, we have a section called What is a CNS? And you can find a little flyer, you can find a little video, and it will just briefly explain a little bit about what I've been talking about today. Also in that site, you will find lots of position papers where we have taken a position on different topics, and we try to render those opinions to make sure that we are getting the word out about where NACNS stands on the many topics that affect nurses and advanced practice registered nurses. One of the big areas that we have taken an emphasis on is full practice authority. It would be ideal if all APRNs nationwide had the same practice authority across the nation, but unfortunately each state determines differently on how that practice authority is determined. And so there are efforts by all of the different groups in all of the states to try to make change there, because there's great evidence showing the impact that we have as APRNs on patient outcomes. And the more authority, more ability that we would have to practice to the full scope of our training, the better we can help patients and the better we can help healthcare improve outcomes and lower costs. In addition to that, on the website, we have a learning management system where modules can be reviewed, one of which tells you about what is a CNS. You can also do various modules on learning more details about the CNS role and topics that are important to clinical nurse specialists as well as nurses. You can learn about our annual conference that we have every year, that we are happy to have, and we're very proud that we don't just get CNSs at that conference. We get lots of nursing administrators, we get lots of nursing students, we get lots of registered nurses who are interested, because our topics cross with different areas. They're not just specific to the CNS. They are very oftentimes cross with registered nurses and the topics they're interested in as well. So that's just a few things on our site, but we have a whole lot more.
Yeah. And I'm like CEUs, is that something that,
Our learning management system offers CEUs on modules that you pick. Some are free to members, and then some are for cost.
Yeah, that's always, I mean, in nursing, that's what we have to make sure we get our CEUs in. So it's nice to have that ready, at your fingertips.
Yep, and some of them are for pharmacology credit as well as standard CEU credit.
Oh, great. Great. Something we talked about that really stuck out to me in our first conversation is the 2022 census and the shift that, is predicted to come. So what does that look like?
So you might want to orient me again, because I think...
Oh, that 30% will plan to retire.
Oh, yeah. Okay. The census for nursing in general. Oh, yeah. I'm happy to talk about that.
Yeah.
So that is a really big topic, and it's an important one. So I'm so glad you asked that question. So not only are we faced with massive retirements of nurses, we are at the same time, it's almost like a perfect storm, have record numbers of baby boomers who are entering older age, and the older age population uses more medical services than any other population. And so that we need more, if not the same, we need more nurses, and now we're going to have less. And then there's this third piece that comes into play, and it's the outcomes of COVID. A lot of nurses had a lot of trouble in COVID, and it was plain as day on our regular TVs, seeing, the impacts of wearing those masks for extended period of time, not enough PPE, and having to take care of patients with a disease that we didn't know how to cure, that many died from. It left a mark on our profession that still has not been resolved. And we are still facing those results, and they include burnout. So all of those pieces, in addition to the census and the impending retirements coming, really creates a situation where we are at a huge shortage of nurses, a shortage like I've never seen. And I didn't mention earlier, but I sit on the State Board of Nursing in Louisiana. I'm a board member, and watching and hearing some of the strategies that different hospitals are using to try to fill in where nurses are not there is a little scary. I do think that we all of the nursing profession, and really any stakeholder in healthcare, needs to come together to try to identify how to improve this, because the solution is not just train more nurses. And the reason that doesn't work is because if you train more nurses only for them to be frustrated very early in their career, they're going to leave. So it is train more nurses, but it's also improve our work environments. making sure that we have all the resources we need. We have staff besides us, and it doesn't just have to be other nurses. It needs to be other members of the healthcare team to help ensure that we have everything we need to deliver good patient care. We need all of the equipment. We need to have all of the PPE. We need to have enough IV poles and thermometers so that we're not searching for them. Just all of those little things add up to the frustration that at the end of the day is why a nurse is so frustrated, is because I couldn't give good patient care today because I didn't have all the tools and I didn't have all the people that I needed to be successful. And when that happens day in and day out, it leads to burnout. And so it is a huge problem. I don't quite think we are collectively all moving together to solve it. I do think there's lots of people interested in it, but I almost think a call for a national summit, something pulling everybody together and just some simple solutions to a very complex problem where we can start is important. And one of them is starting with the recruitment of nurses, but also looking at education programs, of which I oversee, but making sure that we're adding not just skills on how to be a nurse, but skills in working through tough nursing environments. When we give those nurses those skills, they're prepared to respond. And coming from someone in New Orleans who deals with disasters, and we're used to that, I can tell you, you can get through massive disasters or crises without having trauma or burnout if you go into it a little prepared for the uncertainty and that you just solve one thing at a time and you'll eventually get there. So I think we need to build those skills into our nurses, and that will help them.
Well, I feel like what you just described is what a CNS will help hospitals.
Yes, it's a big job.
Right?
That's true. Good point.
Yeah.
I love it.
Yeah. I know I asked this earlier, but I'm just curious, with I hate to talk about age as being a factor, but do you see like this, we had talked about the 30% planning to retire. Are a lot of those the CNS role, or is that's not really looked at too specifically?
No, actually, we do look at that. And it's so interesting that you asked that question. So yes, of course, many of the CNSs are looking towards retirement, but it is actually quite refreshing we watch our membership numbers. We have had a huge influx of student members. And if that can be equated with more incoming and the pipeline building, then that's how we kind of see it. And so I will tell you, we have been very excited at NACNS to watch our student numbers go up. And then something that we call transition to practice, meaning someone who's bridging between being a student and a CNS, those numbers have increased as well. And engagement of our student CNSs and those new CNSs in the national organizations this national organization have been very, very good. So we're very encouraged by the number that we have into the pipeline. We don't have nearly enough, just like everyone else, but I will say we're very encouraged by the number that are looking to become CNSs.
That's great. Well, I guess the work you're doing is paying off because people know what it is and they're wanting to do it.
Maybe so. I hope so.
Oh, gosh. Well, I feel like the information that you've given is really going to give that last bit of encouragement to some of these listeners that have been, toying with the idea. But like, what is the takeaway from all of this? What is like the number one piece of advice that you can give anyone maybe on the cusp of making that decision to go to school or not?
Oh gosh, it was the best decision I ever made. I was unsure the whole way. I didn't have all of the answers, and just do it. Let your gut speak to you and go with it. And it's the best investment. Really look at all the different things we spend our money on, and there's undoubtedly the best thing I've spent. And if you're not really sure, have somebody come along with you. You can go to the NACNS website and you can scroll down to my picture and you can directly email me, and I'll be happy to give you any tips, tricks that I can, or align you with someone maybe in your part of the country that can help move you along. many of us who have moved along in our careers can cite mentors who have helped us along the way, whether it be a teacher or someone in that field, or maybe someone outside of that field that just recommended it to you. I would say be ready and listen. Those people are out there, and when we're passionate about something, we encourage others to do the same. So if you're kind of hearing somebody saying, you know what, you'd be great at this, then, really listen. They're not just telling you that for no reason. It's probably a good reason. And if you're like me, where you are moving along in the nursing profession and you just feel like you could do more, you can. There's no doubt that you can. I never envisioned I'd be where I am today. And I'm so glad I listened to that little girl inside of me saying, maybe I can, I could. I didn't know it, but listen to it.
Oh, I love that so much. This has been absolutely wonderful. I'm so happy I got to meet you. And I think I will probably be in touch in the future because you've inspired me a little bit. So
awesome.
Yes. So thank you. It. Yes, right? Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.